Hi there, and welcome to another episode on Let's Talk Wellness with Shal. My name is Shalini. I'm a corporate tech professional, a yoga meditation certified instructor, and an integrative nutrition health coach. The purpose of this podcast is to empower you with knowledge on holistic wellness and self-care. Tune in to Let's Talk Wellness with Shal on YouTube, Spotify, or Apple to hear this episode. Today, I'm very excited to have Thomas Banta join us. Thomas is a clinical mental health counselor, private practice owner who specializes in treatment of trauma and related disorders. His vision is to help individuals get their quality of life back after traumatic events. After building a solid foundation of trust and safety with his clients, he provides evidence-based therapy to address each individual's unique challenges when healing in the aftermath of trauma. He has made contributions in Forbes, Fox News, and much more. Welcome, Thomas.
Thank you so much for having me. I'm excited to have the conversation.
Yes, I'm super excited to have you here today. So today's topic is understanding trauma and the path to healing. So to begin with, Thomas, what inspired you to specialize in trauma therapy?
It happened totally accidentally. I wanted to specialize in OCD because I had OCD and some really good therapists put it into remission. So that's what got me in the mental health field. I was like, cool, I got my life back. I want to do this for other people. We have a cliche that's you don't find your specialization finds you. And I ended up working for a hospital, and the demand for trauma treatment was really high. So I was like, oh, if I'm going to be successful in this setting, I got to learn how to do it. And there's a lot of overlap between the treatment of OCD and post-traumatic stress disorder. So it's a very natural transition, and I just fell in love with it.
Got it. Okay. I guess, this is also now, I feel one of those buzzwords. Everybody's kind of talking about trauma, but I also feel there's a little bit of confusion with just, the terms like stress and trauma just being used, interchangeably many times, maybe just, unconsciously, not quite knowing what the word is, right? So I would love for you to just expand a little bit for the audience about just the word trauma and stress and how they even compare.
Yeah, and that confusion's fueled by the phrase post-traumatic stress disorder, right? All of the words are in there. The difference between normal life stress and when we get into a trauma disorder is the level in which our lives are impaired by it. So if something bad happens to me and I have a stress response, that's really healthy and normal. If I can't function in my work, my relationships, my day to day, that's where it starts to become an issue. And that's how we measure like disorders, right? And look at it. And then length of time. Like we can't diagnose someone with post-traumatic stress disorder until they've felt their symptoms for over a month. So you think, okay, well, if I get in a car crash and I'm shaken up by that, that's totally healthy. A month from now, if I still have those symptoms and my life's impaired, then we look at, all right, well, let's intervene here and get you some relief.
So it's more like a prolonged stress, if you will, right? If it continues to exist or manifest in different ways.
Exactly. Yep.
So, for listeners who may not realize, right, that they're impacted by trauma, how do you describe its subtle or hidden effects on mental health and just daily living?
So the more subtle stuff I see is irritability. So whenever we're out and about, we have all of this sensory overload and it makes people really snappy, right? They have difficulty handling these day-to-day small frustrations and situations. But if they're confronted with like a chaotic situation, they tend to function pretty well in those scenarios. So trauma is kind of weird like that. And we're really good at adapting and surviving a traumatic event, but we're really bad at going back to baseline. So that nervous system just stays like hyper all the time. But then just, normal anxiety, panic, and then we go all the way to the other end of the spectrum and you see people kind of shutting down. It looks more like depression, dissociation, and numbness. So a lot of times trauma can get misdiagnosed both as like bipolar mania, like, oh my gosh, look at all this energy.
Yeah.
And it can also be misdiagnosed as major depression. Oh, look how low this person is. And the way that we sort of tease that apart is Did these symptoms follow the trauma, right? And are they related to different stimulus that happened during that trauma?
Gotcha. So, what do you say to somebody who's hesitant, right, about seeking therapy for trauma, or they feel like their struggles are not enough to get professional help?
Yeah, so I know how this feels because when I was struggling with OCD, I waited so long to get treatment. I mean, I waited until my life was completely debilitated and taken over by it. And we always find those excuses to minimize our experience, our symptoms. So my advice is always don't wait until it gets severe. I know when I got really good treatment, I got a lot of relief. There was some gratitude that, oh, hey, I feel a lot better. But there was also a lot of grief about the amount of time I wasted feeling bad because I didn't believe I could get better. And then now I know that's not true. And so that was kind of a bummer. Oh, I spent years unnecessarily suffering before I got help. So that's always what I would say to people. Don't wait until it gets too severe. And if you're having that question of, oh, I have these symptoms, should I address them? The answer is probably yes. You don't have a whole lot to lose from going and getting treatment. And it's always easier to treat while we're on the more mild end of the spectrum than waiting until it builds and builds because trauma is cumulative. These symptoms tend to like compound and build on each other, right? So, like, as we start to avoid these small environmental things that remind us of the trauma, our world gets smaller and scarier. And it just continues to get more difficult to deal with. So don't wait. Do yourself a favor and seek out that help as soon as possible.
So, when I think about trauma, right, or even just people who've been impacted, maybe they don't really realize, right, that it's trauma. I mean, I'm assuming is it also things like just, grief for losing, a parent or losing somebody, right? Is that all considered trauma as well? Like, how do you draw the lines? Like, how do you define what exactly is trauma? Or how would somebody even know, oh my gosh, like I just went to this traumatic situation and I need, to help? I mean, get help or just pause. How do they know that?
It is so tricky, especially with grief, because like you mentioned, it can be really difficult to tell the difference. Because when we lose someone feeling really bad, like grief is a normal thing. It's not a symptom for us to treat. It's something that we sort of have to like kind of feel and process on our own. Where it becomes traumatic, I think the hallmark is intrusive symptoms. So these thoughts keep coming into my head that I can't quite push away. They're really sticky and it's causing me a lot of distress. And then, like, environmental things are sort of like setting it off, and whether it's different sounds, smells, things like that are kind of bringing me back to those moments. When we think about trauma, it is a miscommunication in our brain between the memory part of our brain and the emotional part of our brain. And when we take in environmental sort of sensory things, that emotional part of our brain gets first dibs on interpretation, if that makes sense. The example I always use, I was home alone a couple weeks ago. My wife was out of town. I was turning off all the lights, getting ready to go to bed, and I looked into my closet, and we have like a coat hanging on a rack, and there's, a hat above it. But out of the corner of my eye, it looked like a person standing in a dark closet. Stress response briefly kicks in, adrenaline, cortisol, things like that come up. I'm very anxious. And then a couple seconds later, the logical part of my brain powers up and says, hey, you're safe. That's just a person, or that's not a person, rather. That's just clothes in the closet, whatever. In a traumatized brain, you kind of imagine the same process, except that safeguard isn't there. They don't really return back to baseline in a normal amount of time, and their stress response is a lot higher because their brain is trying to help them prevent ever feeling or going through that trauma ever again. So it's kind of taking this better safe than sorry approach. So you just like you have those triggers constantly. It's like it's happening all throughout their day, and it becomes really debilitating. You wouldn't really see that quite as much with just grief, right? You kind of like sort of see a different process. It's not as like environmentally activating. So yeah, and it
Calm.
is difficult. There's a lot of nuance in telling the difference, and that takes a
Yeah,
lot of time.
exactly. I just feel like, I mean, just like you said, right? PTSD. I mean, you have the stress, you got the trauma, everything in the word. So I just feel like, people are just confused. Like, okay, how do I know? Am I experiencing just stress or is this trauma? Is this much deeper? Right? So how do you even kind of draw the line? So that's kind of where I was going.
Yeah, and it almost isn't like, regardless addressing it in therapy, like, all right, well, I suspect that this could be trauma, but I'm not positive, and it can be really difficult to tell the difference. Okay, well, let's kind of examine that in therapy and rule it out. Because I mentioned sort of diagnosis and how that can be tricky with trauma and knowing what's going on. As a therapist, I still like to start with the trauma part because even if it's not a like trauma disorder necessarily, if there's been a traumatic event, it's probably making those already existing mental health issues worse. And so kind of starting there and ruling it out, I think is always a good idea.
So I guess that's a perfect segue into the next question, right? Which is the type of treatments or the therapy methods, right, that you offer. I know there's quite a bit. There's a lot of acronyms: EMDR, CBT, and then there's mindfulness-based therapy, right? So, I mean, I would love for you to talk a little bit about them, and also how do you decide what's right, for each client?
Yeah, absolutely. So EMDR is sort of my main way that I like to treat trauma. It stands for eye movement desensitization and reprocessing therapy. It's the most annoyingly named therapy ever. At its heart, it's an exposure therapy. But what's interesting about it is we add an element of bilateral stimulation. That's where the eye movement part of the name comes in because that's what they started with. So it would look like I'm following the therapist's finger, light bar, whatever, and then we're going back and forth, right? That's the bilateral stimulation. The theory between why we're using that technique is that what they found was with that visual stimuli, it's activating those hemispheres of the brain. Remember the emotional part of the brain and the memory part of the brain, right? Activating both of those things during exposure, and that's helpful to unstick traumatic memories in our brain. And that's where we notice a lot more progress than with just like traditional talk therapy and stuff like that. But we're going to identify the memory that's causing the intrusive symptoms, have that exposure, add that bilateral stimulation, and that leads to really quick relief. It's such a cool process getting to see people heal from that. You mentioned cognitive behavioral therapy. That's another one of like just always going to be on the Mount Rushmore of therapy in terms of its effectiveness. But that's looking at the thoughts that are fueling the traumatic symptoms and the behaviors, the cycle of behaviors that are fueling them. And then we're sort of breaking out of those cycles. So when I experience a trauma, a lot of beliefs form in my mind, maybe around my safety. If I get in a car crash, okay, well, I'm not going to be safe on the road again. Well, CBT helps us sort of identify those thinking patterns that fuel distress and then break away from them, right? If we're being really pragmatic and really realistic, considering the whole picture, what does that look like? And then behaviorally, it's always avoidance with trauma usually. So if using the car crash analogy again, I'm afraid to like leave the house and drive, so I'm not going to anymore. Well, if we're not doing any of that work, we're never going to get the new learning that, oh, I can be safe on the road again, right? So
Yeah.
cognitive behavioral therapy, that's how it would kind of address trauma. Personally, I always use elements of CBT with almost everybody I work with. I just think it's one of those like really great interventions that's really versatile and most people will benefit from it. However, if there is that significant trauma history, EMDR is always where I start just because I love the way it's structured. It's usually really well tolerated by my patients and we get great results. So if it ain't broke, right? But yeah, those are the two main ways that I address those. Mindfulness is a factor again with all of those, kind of a cornerstone habit with
Yeah.
trauma. We talk about a lot of times our brains are assessing threat, we have a flashback, so we're almost going back in time to how we were feeling. And mindfulness, as I know just given your background, helps bring us into that present moment, remind us in our nervous system that we're safe. And so those are really great tools outside of the therapy session to help turn the volume down on some of those activations that can happen.
Gotcha. Got it. Wow. Yeah, that's really interesting. So I'm then curious, like the, clients that typically come to you, I guess, how do you even identify, or maybe you can just give us maybe one or two examples, right? Just, and maybe the themes of, the clients who come to you, right? What kind of background or what is it, that they come to you with? To
Mhm.
say, hey, I'm experiencing this or I'm going through this, right? I'm just trying to high level this as just, a couple of themes, right? What do you typically see? And I'm also curious, what age groups, I mean, typically do you interact with?
I'll work with anybody basically 18 and up, but it's usually 18 to like 55. That's usually the group. You go a little older and they don't typically believe in therapy.
Yeah.
And then I'm not brave enough to work with adolescents. So that's sort of where I'm at. In terms of issues, the main one is usually sexual violence, unfortunately. So we think about 30% of women are going to experience that at some point in their life. And then 60% of those women are going to develop post traumatic stress disorder. So women are twice as likely as men to develop PTSD. And the reason isn't because of any biological difference. It's because the nature of the trauma is so much more intimate, and that's just kind of a breeding ground for a trauma reaction. So that's usually the main issue. Another one that gets talked about a lot less that I see a lot is pregnancy loss. And again, it's one of those things that about 20% of all pregnancies end in loss. And again, 33% of those women are going to develop post-traumatic stress disorder, and about 8% of the men, so like the husbands or the boyfriends or whatever, are going to develop post-traumatic stress disorder from that. That gets a lot less airtime. So I kind of like to bring awareness to that sometimes because it is so common. Like some people have this idea, well, I was never in combat or experience,
Yeah.
X, Y, and Z, so I can't have PTSD. But the reality is
Mm.
that's not, our nervous system isn't sitting there like wondering, does it fit this criteria? That's not really how any of it works. So those are kind of the main ones. Yeah, yeah, that I'll see on a given day. And then like
Okay.
I do a lot of work with veterans court as well. So these are veterans that usually have substance use issues that get in trouble with the law, and they're trying to keep them out of prison. So I work with them. And that's mostly men. And then, it has all of the things that come along with whether they were in combat or if they had abusive parents, things like that. So those are the most common stuff.
Got it. Got it. So, I mean, what are some of the myths about trauma recovery that, you often encounter, and how do you address them?
Well, and that's so the big one is always soldiers. Like that's what we typically assume post-traumatic stress disorder always looks like because it just gets the most press. There's a lot of political will to work with veterans and treat their PTSD, which is great, but it kind of puts everyone in this box of if my trauma didn't look like that, then it's not valid or it's not really trauma. So that's a big one that I do see. Um, and then trauma, in terms of other myths that sort of come up, it's mostly the body keeps the scores really popular right now, which is great. It's a mostly like fantastic book. Some people tend to take it a little too literally, I think, and so kind of undoing some of like maybe the psychoeducation that can kind of lead people down the wrong paths or to treatments that may not really work very well, if that makes sense. Like I was seeing something, it was a viral post on Instagram, and it was like trauma's like stored in your tattoos, and they were trying this like, some type of weird intervention to remove that trauma. So I see a lot of bad information that sort of
Yep.
like comes out of a really good book. Like The Body Keeps the Score is a great book, but people really ran with it anyway. So those are the main ones.
Gotcha. So, what are some simple self-care practices that people can adapt just to build resilience, even before they get to the therapy stage?
Yeah, there are three. When we're studying resilience and seeing people who went through trauma and did not go on to develop post-traumatic stress disorder, there's three characteristics that we're consistently noticing, and that's optimism, confidence, and a challenge mindset. So that's when I experience conflict, I'm looking at it as a challenge to overcome rather something that's just happening to me. And we know through cognitive behavioral studies and things like that, we can change the way that we think and see the world and interact with it. So those three components, I always encourage people to really try to facilitate in their own lives and nurture, because it leads to this openness that I think has us trying new things and staying engaged with the world. And then when we have those and we experience a trauma, we end up having much better outcomes because we're not shutting down and going into these avoidant routes and things like that. So that's those features are big, the way that we think and see the world. And then this little one that I love, I can never get it out of my head because the research is really cool. Playing Tetris. So, the light block game that falls down, for people who
Hmm.
don't know, it's been around, I don't know, since, the 70s or whatever. But basically, they took people who were in car crashes and ERs And they had one group play Tetris and they had the other group not play Tetris, or the control group. And what they found was the group that played Tetris had like a 62% reduction in intrusive symptoms after the car crash. And then they took this research and they looked at nurses during the COVID pandemic that were working in ICUs. So they were just seeing people die all day, every day. And trauma was a huge issue with keeping them working, right? So they had one group play Tetris after their shift. So within 6 hours of the trauma is basically what we're looking at. And they only had them play for about, 10 to 20 minutes. And the group that played Tetris had 1/12 of the intrusive symptoms as the group that didn't, right? So huge reduction. And then we took combat veterans that were diagnosed with post-traumatic stress disorder. So if you have post-traumatic stress disorder and we scan your brain, what we typically see is they have a shrinked hippocampus, basically. So that's kind of our thumb drive of our brain. It's our memory storage center. Its job is to take in sensory information and compare it to previous experiences to determine whether or not it's a threat. Anyway, so they scan their brains, they have the small hippocampus, then they had the combat veterans with PTSD play Tetris every day, right, for 10 minutes a day, and they had a group that didn't. Both groups were in therapy, getting EMDR, which was great. But the Tetris group versus the non-Tetris group, their hippocampus had reinflated significantly more and faster than the group that didn't. Now, it's not just specific to Tetris. Any type of puzzle game that has like that visual component will probably give you the same outcome. Tetris just happens to have been around forever and is mostly free, so you can kind of play it. So that's my little tidbit that I think is really fun. So now when I'm playing Tetris, I just tell my wife it's for my mental hygiene. But that's something that I've implemented in sort of my life, just dealing with sort of the difficult content that I do. And then I'll always slip it into aftercare for my patients sometimes. If we're doing EMDR, I'll kind of tell them about the data, and if they like gaming, that they're usually excited to implement that into their self-care. But those are the main ones, little ways that we can help ourselves.
Got it. Awesome. Hey, thank you so much, Thomas. I know we're almost the end of this episode. This is a lot of information. I mean, I learned a ton here, and definitely I'm hoping the audience is now at least able to understand a little more about what trauma is and when and how they can, go seek therapy. So Thomas, do you want to share where people can find you, and do you do virtual, do you do in person, etc.?
Yeah, thank you so much for this opportunity. Banta Counseling on Instagram. I make a lot of educational content on there. I love doing it. On my website, Banta Counseling, you'll have a lot of my writing contributions. I have a blog. I have an email newsletter that focuses on sort of current research and trauma and how we can take care of ourselves through that process. My practice is virtual. So I see clients in Ohio and Indiana, and so we can process trauma through the comfort of your own home. I got evening and weekends availability, and I try to make that process fast and accessible for people. But thanks again for having me. I love talking about this stuff.
Thank you so much. I really appreciate your time today. Thank you.
Yep. You have a good one.